Doug Goldstein, eFuturist, Health Innovation Media, Health Ovate Boston. We have Dr. Danny Sands, a leader in participatory medicine. In fact, you're the co-founder of the Society for Participatory Medicine, which is a big game changer in the whole world of health and healthcare. Can you share the mission of the Society for Participatory Medicine and some of the other things you're working on?
Sure. So the Society for Participatory Medicine was created in 2009 to really push this idea, this concept of participatory medicine. So if you look at healthcare today, as it's commonly practiced, healthcare is more of a spectator sport. That is, patients are kind of disengaged. They go in to see me, a doctor like me, and they say, "Doctor, I'm sick, fix me." I mean, that's kind of like a car wash, right? It's the car wash model of healthcare where what happens is, I'm the car going through the car wash and I'm getting health sprinkled on me, right? That model doesn't work. If we're going to have a healthcare system that achieves the triple aim, or now the quadruple aim, improving the experience of healthcare, improving the quality of the outcomes, keeping costs down, we've got to think differently about this. What we need is to think about healthcare as a participatory sport, not a spectator sport. Thinking differently about healthcare is really about healthcare should be a collaboration. So Doug, if you're my patient, okay, rather than thinking about healthcare as a service industry, I hear that all the time, it's just not quite true. You're my patient and you and I should be collaborating around your health, keeping you healthy, keeping you, making you well when you're sick. That has to be a partnership. Because I can suggest things to you, I can tell you what's going on with you, what you need to do, but unless you're engaged in that, you're asking questions, you're doing the plan that we agree on together, by the way, then nothing is really going to happen. And some of that takes place a lot of that takes place out of the doctor's office. You spend most of your life out of the doctor's office, so you need to be doing things to promote your health and wellness in between visits. And so this is what participatory healthcare is all about. It's about transparency, it's about sharing decision making, it's about thinking differently about healthcare. Now that sort of leads naturally into what I do in the rest of my life. So in addition to public speaking and a variety of other things and working with the society, I'm a primary care physician. But that's only part-time. I'm the chief medical officer of 2 early-stage companies.
I want to reinforce that you're an incredible physician and you're a leading expert that's a sought-after speaker in health, in fitness, and in life. Wow. And you're making a huge difference wherever you go. And I know you work with a couple really cool companies like Conversa. So could you share a little bit about what Conversa's doing?
You do need to offer a disclaimer. Although you have heard me speak and do other things, you've never been my patient, so you can't actually say I'm a great doctor.
But I've talked to your patients, so they tell me the case, and I can tell because you found it. You figure out how to engage each person individually, and that's your secret sauce.
It's really important. I think communication is fundamentally a piece of this. Communication and collaboration. So so the 2 companies. One is called Kinergy Health. And Kinergy Health is focused on helping patients and both formal and informal caregivers be more engaged in their health. So it's a platform for collaboration around the patient's health. If you think about a patient portal that many people have access to now, patient portal is one healthcare institution. You're connected to that institution, that's it. And in fact, you can't invite other people into that conversation. That conversation that you have, the dialogue is between you and your doctor in that facility, right? With Kinergy Health, you, the patient, or if you're the caregiver for a patient, it might be you own this platform. You own this, sponsored by a healthcare system, and you have now a place to aggregate all your health information from all different sources. You can collaborate around your health, invite people into it, and so on. We also provide a Kinergy Care Navigator to help you manage your information and advocate for yourself. So that's Kinergy Health. The other company is called Conversa Health, and I'm the chief medical officer of that company. And this company, our slogan is, health happens between visits. We believe health care should too. And really that's it. The healthcare system that we have was created, the way we practice healthcare was created a century ago. And at that time we had an epidemic of acute conditions. And we created a visit-based system to deal with that epidemic of acute conditions. Today, we still have some acute conditions. We've gotten rid of a lot of them, and now we have an epidemic of chronic disease. We need a different model for taking care of healthcare. So the visit-based model doesn't really work for this kind of longitudinal care. So what we're advocating is highly tailored, highly customized, frequent light touches using technology in lieu of big expensive visits. So that's fundamentally what we're doing, and we have some incredible technology behind it, a lot of knowledge, medical knowledge behind it, so it's very exciting as well.
Well, you're doing great work, and I think the concept of participatory with the person filters through all your work. Any big takeaways or insights from Health Ovate Boston?
Sure. I mean, this was a great meeting, very interactive, a lot of dialogues going on, some innovative companies. And, I think the idea was to really open our minds, think differently, think more innovatively. And I think that for me, some of the takeaways are that innovation isn't always about that really sexy idea. Because a lot of sexy ideas are just not going to float. You got to really think overall about how is that going to work? How is it going to execute this? Are there people willing to pay for it? I saw some ideas today that were really cool, and they run the spectrum from companies that are doing very innovative things, but not sexy in the least. Companies that have identified a problem, very real, they've quantified that problem, and they've created a solution to that problem that people are going to be willing to pay for and already are paying for. Then we have another company that is, and I'm not naming the companies sort of intentionally and partially because I can't remember all their names. We have another company that is, identified another problem, a huge costly problem in healthcare, and is using actually much more high technology to really use information, manage supply chains, manage logistics, really innovative approach to dealing with a problem that nobody's ever touched before. So it's not just about the really cool tool that's out there. It's about how you integrate that into existing environment and what problems you're trying to solve and figuring out who's willing to pay to solve that problem.